Good afternoon, ladies and gentlemen. As you are aware, it is now just over 24 hours since it was announced that Barbados had recorded its first two cases of coronavirus, COVID-19. And as you are aware as well, the Prime Minister has promised that everything will be done to keep the country informed on developments with daily press briefings. And this essentially is the first of those briefings. And with me is Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostic, and Acting Chief Medical Officer, Dr. Anton, and they will answer your questions. So feel free to go right ahead with your questions.
All right, my first question, can you give us an update on the two people who have been diagnosed with heart conditions? How things going with them?
The two persons that we would have reported as confirmed cases yesterday are both in isolation at our isolation facilities and being treated in terms of the coronavirus.
Minister Bostic, these two persons were they screened at the airport at the point of entry? Also, as relates to testing, in the US, we see a case where the lack of wide-scale testing has placed the US behind the eight ball as it relates to getting ahead of the virus. What is our capacity to do wide-scale testing? And if we are not at that capacity at this moment, when will we be there?
First of all, both persons would have been screened at the ports of entry. But remember, when persons arrive at our ports of entry, they are tested in terms of the temperature by use of the temperature machines that we have. They are looked at also by the persons who are doing the surveillance. And if persons show symptoms of COVID or flu-like symptoms, or indeed if they have high temperatures, then they are removed and they go and they are seen and investigated by a port health nurse. So if at the time of arrival you do not present with symptoms and you don't have a temperature that would create an alarm for us, then at that point in time for us, then you are allowed to go through. But however, if you develop the symptoms having reached your home, your hotel or wherever, then that is when we ask persons to report to a medical facility by telephone or to call a private doctor, and then that is how we are able to deal with it from there.
As it relates to the testing?
As it relates to the testing, our emphasis has been on surveillance and enhanced surveillance, because we believe that if we can detect it at the port of entry, then it would reduce the need for testing at that stage, bearing in mind that test kits are limited globally, and we have to operate within the confines of the resources that we have. So we do selected testing based on your travel history and when you present with symptoms. And that is the policy that we've been following so far.
Minister, can you tell us how many persons have been tested in the last 24 hours and how many test kits we will have available now?
I can tell you that we've tested about 13 people yesterday, and there are 11 persons who are due to be tested today. Those persons who were tested yesterday were all negative. In terms of the testing kits, we have increased our capacity through some kits that were presented to us by PAHO, and the government of Barbados is in the process of purchasing a lot more kits, and the first set of kits that we are going to be purchasing, those kits are due to arrive on the 4th of April, with another set of kits coming in a few weeks after that. And we also have a third set of kits. So this is a continuous process, and we will purchase kits depending on, purchase a number of kits depending on how the situation develops.
What has been the update with contact tracing of the people who
So contact tracing, as you would appreciate, is one of the key strategies that we use in public health to be able to identify cases. And once we, through that index case, so we have 2 index cases, and contact tracing has begun, and it would have started from yesterday, and it continues and will continue for the next few days.
Have you been able to track down people who were on
So what we have done for the contact tracing so far is identify the people that we need to approach. We would have asked those persons, have you had any symptoms in keeping with COVID-19? In addition to that, at least one of those persons who were identified through contact tracing have been tested. But this is a process that's going to take the next few days for each case.
Doctor, can you tell us how many persons have presented in the last 24 hours, either asymptomatic or symptomatic, to the different agencies across Barbados?
No, we don't keep a tally of the total number. We do receive a lot of calls on the hotline, and then I myself receive calls, and my colleagues receive calls as well. So what we do at that point is we make a judgment call. Is this a likely case of COVID-19? What's our index of suspicion? And if we have a relatively high index of suspicion, we then refer that person to the list that the Minister alluded to, where they then get screened with a definitive diagnostic test.
We understand, Minister, that the hotlines have been bombarded in the last 24 hours. Can you tell us if government is in a position or has increased the number of personnel that would be attached to that area?
We've increased the number of lines, and we are in the process of increasing the number of persons working those lines. What is happening is that the number of calls that we are receiving on a daily basis has really been very high, which is good because we want to be able to engage with the public. A surprising thing for us, for example, is the number of calls that we've been getting from overseas persons who want to visit Barbados and who are trying to find out exactly what their status would be on arrival in Barbados and the facilities we have in Barbados. So this thing has been going so well that sometimes people may have a delay in terms of getting a response, but you also have to understand that we are dealing with matters that require discussion and explanation to people, so that when you think that no one is on the line, actually someone is on the line dealing with a client. And that process sometimes can take a bit of time. So we really call for people to be patient. It's like any other call service, even if you call overseas, international call services, there's a waiting period. If you call Flow, you have to wait in line because there's a queue. And that is exactly what is happening now, but it is not that persons are not there.
Given Barbados' heavy reliance on surveillance, do you think, and unfortunately 2 persons have passed through that dragnet, do you think there is now a need to up those measures to some extent?
We escalate measures depending on the risks and also the development of the virus across the globe. And to be honest with you, yes, we had 2 cases confirmed yesterday, but up to yesterday, Barbados was one of 27 countries that had no confirmed cases. So I think that that speaks to some extent to the level of surveillance that we have been utilizing at the airport. But we have been escalating and will continue to escalate because right now, for example, Europe is the new epicenter. It may shift. So we have a nimble response that would allow us to be able to have the level of flexibility to enhance our surveillance.
Minister, we were told earlier that the time frame for test results after presentation would be around 4 hours. Now that we have more people being tested, is it longer? Will people have to wait longer to get results having been tested?
So the 4 hours that we talked about where the laboratory test is concerned is in relation to the time of the test. So once the lab receives the sample, it takes approximately 4 hours to get a test result. What we've had to do is to batch people. So we're running testing clinics, so where people come at a specific time, at a specific site to get the sample. So then the sample then has to leave that site and get to the lab. So once it gets to the lab, it's within 4 hours of unpacking that you're going to get a test result. And overall, the time still remains within a 12-hour window.
Okay, Dr. Bass, with regards to the first 2 confirmed cases, do they have any pre-existing conditions and disease, anything, are they mild, moderate, or severe?
The cases are mild. One of the patients does have bronchial asthma. This is something that they've had from the time they were a child. But in terms of the presence of other chronic illnesses, no.
You said there were 2 people in quarantine, in isolation. Is there anybody in quarantine facility?
Yes, we do have persons in quarantine as well.
How many?
At this point, it is 1 person.
On top of that question with regards to quarantine, thinking self-quarantine, do you find Barbadians are taking it seriously? Like some persons coming back from the US, they're going home, yes, the house is shared with other people. Are they quarantining themselves within the homes, and are they leaving home?
Yes, so I should have clarified. When I talked about quarantine, I was talking about the quarantine facility. So those persons, that person absolutely needed to be in a facility where he needed to be monitored and watched. There are quite a few more people who are at home and they're under self-quarantine. So what we do is we have a public health team that makes contact on a daily basis with those persons to verify that they're doing what they're supposed to be doing and taking temperatures and asking about the development of symptoms. These are people that we aren't categorizing as high risk in terms of the likelihood that they would have COVID. They're actually low risk. And so far, none of those persons have developed COVID-19.
How many are in?
I would also like to add to that, because I think it is important in terms of the question that was asked in relation to how serious Barbadians are taking this thing. I can tell you that we've had quite a few Barbadians and some visitors who have been in self-quarantine and have actually called the Ministry of Health and Wellness to indicate that they were not feeling well. And this is exactly how the system is supposed to work, so that we can then make an intervention. So I am sure, in my mind, that the persons who we have self-quarantined or self-isolated, that they've been taking it seriously.
Let me follow up on that question in terms of people actually doing what they're supposed to do. We're in stage 1 now, and you're cutting down on gatherings of 100 people or more. How is that going on, and how are you going to ensure that people are not gathering in hundreds or more?
Let me clarify that a bit to indicate that the gatherings refer to non-essential activities, and we've cited, for example, like sporting events, cultural events, etc. And that is something that we are depending on every single Barbadian to be able to help us to observe and to do, because for sure we cannot be in all places at the same time. But this is something that affects us all. And we are calling on the common sense, the good nature of Barbadians that we know, to be able to help us to achieve this, recognizing that this is one of the measures that would allow us to contain the spread of the virus. And I believe that, generally speaking, Barbadians will cooperate as we go along.
Dr. Best, the one person that is in quarantine, should we naturally assume that person is symptomatic?
No. So if that person was symptomatic, that person would actually be in isolation, or rather if they were symptomatic, they would be tested, we'd get a result like that, and it would make, so we can make an informed decision if they were in quarantine or in isolation. So the persons in quarantine are usually, in most circumstances, persons who are asymptomatic, but they have a history of possible contact with a person who was COVID-19 positive, or we have another reason to strongly suspect that they may have it.
Dr. Best, can you continue now? Given the fact that government has pretty much been on the ball as it relates to the traceability, tracing these persons, etc., and the fact that you already have tracked down one of the persons, the 2 persons are already in isolation, is it safe to assume that the chances of community spread is pretty low?
That is an assumption that we can't make.
And we cannot make the assumption, but I can tell you that we are doing everything possible to ensure that we are in a position to limit the amount of transmission if there's indeed transmission, because containment is really the strategy going forward. Our mission is to contain the spread of this virus, and we're doing that, first of all, by identifying if there were contacts, and yes, there have been contacts as we have indicated, by locating those contacts, by isolating the contacts either but through quarantine, self-quarantine, or if those persons have developed symptoms, into the isolation facility, and finally to be able to treat those persons either by monitoring those persons who are in self-quarantine or treating those who may be placed in an isolation facility.
Can somebody who has caught the virus and recovered catch it again? Is that possible?
So there's a lot of debate on that, and from the best of my knowledge, it seems as though the persons who were diagnosed with it and then found to be negative and then developed it again actually continue to have it right through. But the science on this is still very early. As you can appreciate, there's a lot of academic institutions who are involved in the research, and a lot of science comes out on a daily basis. So there's a lot that we're learning every single day where COVID-19 is concerned.
Okay, some persons in Barbados heavily rely on sanitary items. For instance, who might have had cancer or people with special needs children, and now there are the restrictions within the hospital, within the supermarkets to one item. Is there any exemption for those persons who need them?
Not to my knowledge. I don't know if the Minister wants to make any comment on that.
What I can say is that the government of Barbados, through all of its ministries, we are trying to ensure that there are adequate stocks of everything as far as possible here on this island. And that is why, for example, even with pharmaceuticals, that the director of the Barbados Drug Service has been directed and given the resources to be able to stockpile an additional 6 months of pharmaceutical supplies so that we have enough on island. And we are working with our social partners, the Chamber of Commerce, the manufacturers, distributors, to ensure that we have enough items available for Barbadians.
Minister, there's a level of fear and anxiety that still remains in Barbados regarding the fact that our borders remain open, our ports remain open. What is your advice to those Barbadians that still feel a high level of anxiety with those ports still open and running?
What I can say to you is that almost every single country that closed its borders, the virus is there, and in some cases in large numbers. I would say to Barbadians not to panic where this virus is concerned, but to have faith in the system, in the government, in the Ministry of Health and Wellness, in the procedures that we have established, and recognizing the extent to which the government has gone to ensure that we are prepared for this virus. Because I would argue that Barbados is much more prepared for this pandemic than we have ever been for any other pandemic in terms of the facilities and the resources that have been placed at the disposal of all ministries to be able to deal with this issue.
As we look to the future, my question is, will there be any changes when it comes to policies at the hospital? So in terms of nurses, doctors, do you find people are wearing their scrubs to work, they wear their scrubs from work? You have the caretakers going into home health, they're wearing their uniforms in, they're wearing them out, they're wearing them on the bus, everything. This is a concern for a lot of people, and as renovations happen at the hospital, will you guys put in lockers, policies?
Right. So what I would say is that this is a standard issue that infection prevention and control has to deal with. So essentially what the evidence is telling us is that you have to focus on those basic principles of hand hygiene from a personal perspective, respiratory etiquette for persons who are ill to avoid coming to work. Because you also have to consider it's not just the healthcare workers that are going into facilities, it's also visitors. So we would also advise people who are coming to visit their relatives and friends in hospital, do not come if you're ill. So those are the measures that we are putting in place to ensure or to reduce the likelihood that infections don't come in. But this is a standard thing that happens year-round, whether there was COVID or not.
I just have another question in terms of treatment of people with COVID-19.
Sure.
What is the treatment process? You know there is no
So,
vaccine.
right, so there's no vaccine for prevention, and then there's no specific antivirals for the COVID virus. So the treatment up until this point is supportive. So for instance, if you have somebody who's in respiratory distress, you're giving them fluids to maintain fluid balance, you're giving them oxygen, and monitoring them at the same time. For those persons who have pain, you give them analgesia, and for those persons who have fever, you give them paracetamol to reduce the fever. So that's what we call symptomatic treatment.
I also saw something saying that you shouldn't take ibuprofen.
Yeah. So a few days ago, we would have been alerted at the fact that in some places where NSAIDs were used, non-steroidal anti-inflammatory drugs, patients worsen. I'm not understanding why, but right now the recommendation is to focus on the use of paracetamol for pain and for fever reduction, as opposed to NSAIDs, such as ibuprofen, Voltaren, Cataflam, and other drugs in that category, aspirin.
Dr. Best, there has also been some information coming out, not necessarily from sources, but it is out there, that cocktails, including antiretrovirals, are also being used. What can you speak? What can you say about that?
So what I can say is that there's a tremendous amount of research right now going on, but at this point we don't have sufficient data to say definitively that these forms of therapy are working. And by that I mean there's the absence of what we call randomized controlled trials to prove that these particular interventions are efficacious and effective. But that may change in the next 3 months, in the next 6 months. But at this juncture, the major global health institutions, the World Health Organization, the US Centers for Disease Control and Prevention, are not recommending any specific therapies that actually kill the virus because we don't have sufficient evidence.
If there are no more questions, thank you very much, ladies and gentlemen. Tomorrow we will also do this, as we have committed to doing a daily briefing, but we will endeavor to do it earlier in the day to facilitate production. Thank you very much. Have a good evening.